Hi everyone, and welcome, and thank you so much for tuning into this webinar with Qendo. We are really excited to bring you this discussion around cannabis in Australia, which we know is a really hot topic given how many people with endometriosis, adenomyosis, pelvic conditions access it. We also know there's loads of information out there, and there's also loads of misinformation out there. So we're really excited to bring you today a panel of experts from advocacy who work in the area, who prescribe and also educate in this space. Please welcome Tegan Skates, who is the founder of High on Hemp, Deandra Phillips, who is the Chief Operating Officer of Tetra Health, and a long-term person who's been working in the space with medicinal cannabis. Dr. Wendy, who is a GP from Victoria and prescribes medicinal cannabis, and Georgia Stewart, who many of you might know. She has been an endometriosis advocate for many years. So thank you everyone for coming and for your time today. I would really love for you to introduce yourself so people can get to know who you are and why you became in this space. Deandra, if you'd like to kick off, we'd love to hear about you.
Sure, thanks so much, and great to be here. Like Jess said, my name is Deandra Phipps. I'm the COO at Tetra Health. I've been in the cannabis industry for about 4 or 5 years now. First in Canada, which was a much different, country as far as its regulations. We had over 400,000 patients when I left 2 years ago to come to Australia. And wow, when I got here, I felt like I kind of went back in time a few years. So it's been really great to found a company like Tetra and see the industry grow, and can't wait to discuss more about it today.
Thank you, Deandra. It's a very different space, isn't it? And it's exciting to bring some education here today. So thank you. Wendy, how did you get involved in medicinal cannabis in your practice?
Yes, well, after being a general practitioner for many years, somebody approached me about prescribing medicinal cannabis. And like Deandra said, it's a very clunky process of applying for permits. And I did have an interest, so I did embark on the journey. And now I've got hundreds of patients that I do prescribe for with, I must say, some of them have amazing results. And that has fueled my interest in continuing to prescribe.
You touched on a really interesting point there. Some of them were able to see some benefits, and we'll get into that a little bit later. So just park that thought, everybody. We'll move on to introducing you to Tegan, who's the founder of High on Hemp, and welcome, Tegan.
Thanks, Jess. Thanks for having me.
So tell us about High on Hemp and who are they? What's in the name? Give us some info.
Yeah, sure. So I started High on Hemp in 2014. So it just started as a little old Instagram account, which has really started to grow over the last couple of years. So essentially the platform was created to educate and raise awareness of cannabis here in Australia and showcases how its purpose can change the way that we live. So when we first started, we really concentrated on the hemp industry, but over the last couple of years, we've now expanded into, the medicinal cannabis world and had a particular focus on black market products as well, which I'm really excited to talk about.
Fantastic. Thank you, Tegan. And Georgia, lots of people know you, Georgia, and really excited to have you on here. Tell us a little bit about you.
So my name's Georgia. I'm an endometriosis advocate. I've been advocating for endo for almost 2 years now, mainly on Instagram. I got prescribed medicinal cannabis almost a year ago, so I have been sharing my experience online with using medicinal cannabis, and yeah, I'm just really excited to talk today about how much it has made my life easier. So, yeah.
Absolutely. Fantastic. And we really see medicinal cannabis as a tool for a toolbox. So well, at Qendo and in the community, we talk about everyone has a different toolbox and things will work for some, it might not work for another. And medicinal cannabis is another option for people. when you may not be interested in having another surgery or perhaps going on high level opioids, it's another option to try. It's another physio option, or it's another osteo. It's just another option. But it also is quite difficult to understand, isn't it? And so today, what we're going to talk about is some of the costs involved, the process, the eligibility, what are some of the experiences, and really finding out some of the information that a lot of the people in our community have asked. And when we put this poll up on Instagram and on socials to say, do you guys want to know about it? We had so many people come in and say, yes, please help me, because I want to know if it's an option, and really how to do that. So we'll dive straight into it. And I'd love to open the floor up to Deandra, who's going to talk around patient access, the cost involved. Deandra, can you talk us through this labyrinth?
Certainly, definitely, and it certainly is a labyrinth, but the good news is it's gotten a lot easier. So to introduce Tetra a bit more, we're a medicinal cannabis clinic network, and we assist patients by connecting them with doctors throughout Australia. So we help streamline this very, convoluted kind of prescription process, and we provide ongoing support through our amazing team of specialist nurses to ensure that our patients get the best possible treatment outcomes. So, it's really great to be able to chat here, about medical cannabis and its role in helping with symptoms of endometriosis. And we certainly see a lot of patients come to us with conditions, similar to this, and they do get approved. So I'll let Dr. Taishan kind of speak about the results, but I'll get into the process. I think that the patient community and the healthcare community have a few assumptions around legal medical cannabis. One, that it's hard to get approval for, two, that it's going to get you high, and three, that it's very expensive. So I guess I'll just break down some of those stigmas and chat about, the overall process. So like we were saying before, cannabis has been legal for almost 3 years, and that might seem like a long time, but in comparison to other countries like Canada and the US, where we've had legal systems in place for almost 20 years, and like I said before, 400,000 registered patients, it's definitely still in its infancy stage here in Australia. So it's estimated that we have about 17,000 patients or so, and we hope to see, we're seeing about 5,000 new approvals come in every month, so it's definitely gaining traction. Now, because we're still in our infancy stage, there's a huge educational gap in the healthcare industry. So our doctors are not taught about medical cannabis in medical school, and it can be sometimes quite confronting, I think, both for doctors and patients because of some of the stigmas that surround the plant and the potential effects that it might have. So we get calls all the time from patients wanting support in how to approach their physician for a referral, or even just to talk about medical cannabis as a potential treatment option. And, it's understandable because a lot of people feel like they're disclosing this dirty recreational habit. And I think there's a lot of people that have anxiety and a lot of stress around approaching it in a medical way, because they feel like they have to justify their use of cannabis. And I think they're scared of what their doctor might think, about what their their family might think, what their colleagues at work might think. But that said, we always encourage our patients to disclose their use, or at least talk about it with their physicians, because it's so important for your entire physician network or your circle of care to be informed about any new treatment that you start. And that safety and the continuity of care is so critically important to ensure that you're safe and you get the best possible treatment from all of the physicians involved. So, all of that considered, of being on the front line for the last 2 years at Tetra Health and working collaboratively with a lot of GPs and specialists, we see that physicians are becoming more and more open to discussing the potential of medical cannabis as a treatment option. So, even if physicians aren't willing to prescribe, we're definitely seeing them, not wanting to be gatekeepers for treatment, and at least referring or providing assistance in finding another medical cannabis specialist, at a clinic or some other route that would be actually really open to assisting them. And, a lot of physicians are prescribing, cannabis over other classes of drugs like opioids, benzodiazepines, and SSRIs that sometimes have more significant side effects than cannabis. And when cannabis is monitored and titrated properly, we are actually seeing a lot of really positive effects without some of those side effects that they might experience from other medications. So, if you're finding that you can't get a referral from your physician and you require one, you can simply call the clinic reception at one of your GPs or specialist clinics and just ask them for a health summary and ask it to be faxed over to the clinic that you're working with or the doctor that's requesting it. And it's at a click of a button for the reception team. And it just basically states your diagnosis, which you of course need to have a chronic condition, which means that you have something that's lasted for more than 3 months, and you've tried some other form of other therapy. So whether, like I said before, whether it's an opioid or a benzodiazepine, SSRI, depending on your condition. So that gets sent over. It confirms everything that your team needs to know about your diagnosis and the current medications that you're taking. So we can screen for drug interactions, and it's as simple as that to kind of get the process started. So as far as the pathways to access, other than a clinical trial, cannabis can be obtained in Australia through 2 different government regulated pathways. One is called the Special Access Scheme, and the other is called the Authorized Prescriber Scheme. So the Special Access Scheme, or we call the SAS for short, allows your doctor to apply for an application through the Therapeutic Goods Administration, which we call the TGA, and you and your doctor receive an approval for a specific product. Now that approval lasts for 1 year, and that also requires a prescription to be sent to the pharmacy to be eligible to dispense for you. So if you do require a new product or a change in product, your doctor will have to apply for a new SASB approval and write a new prescription for you. Now, that's done through a portal, and it's a lot easier now than it was, say, a year and a half ago when everything was done by paper and submitted electronically or through the post. And the TGA have a 24 to 48 turnaround approval time, which really speeds things up. So there's a lot of stigma around this, and it takes so long to get approval, and it's going to take me months to seek approval. But because the TGA have this mandate, approvals actually go through quite quickly. I would say about 80% of approvals for cannabis products are sought through obtained through the SASB program. But what's becoming more increasingly popular is called the Authorized Prescriber Scheme, or the AP scheme. So it's actually a status that your doctor can apply for through a Human Research Ethics Committee, which we call an HREC committee. And it allows them to prescribe without actually having to obtain that SASB approval. So they can prescribe cannabis for a certain class of indications, so like chronic pain or anxiety or PTSD, and they can then also apply for certain products. So every time that they want to add new products or new indications, they'll have to go through this process. And it does take a couple of months, but being able to bypass that SASB program and approval process allows them to script freely. So it actually does speed up the process a little bit. Now, it is a misconception that a doctor must be an authorized prescriber in order to actually seek approval for their patients, but this is false. So any medical practitioner, meaning a specialist or a GP, can apply for that SASB application with the exclusion of GPs in Tasmania. Now, this is the only state that has some tough dispensing and also prescribing regulations. But in addition to that, and I think where the problem is that 80% of GPs would rather refer, more because it's just that they don't have the same knowledge or education about what products to prescribe, how to monitor and titrate dosing, and they want to kind of leave it to medical cannabis specialists, which there are plenty now across Australia. So under the SASB scheme, depending on the doctor's state or territory, as well as the type of medication they're applying for. So just as a side note, in Australia, there's 2 classes of scheduled medicines that apply to medical cannabis. One is called Schedule 8, which is THC medications. So anything with high amounts of THC are just pushed up into Schedule 8 and do need a state health department approval in some states. So S4 medications are medications that are predominantly CBD and are 98% or more CBD. So if it falls into that other 2%, where there's 2% or more of other cannabinoids, it actually gets pushed up into a Schedule 8. So there's not a lot of CBD S4 medications in Australia. So through this process, each state is very different. For example, Queensland Health is not involved at all in any part of the approval process. Victoria has actually removed requirements to actually seek the state health approval until September 30th due to COVID. And then South Australia, Western Australia, do require approvals. But if you want more information about that, you can definitely jump on our website and check out a state-by-state guide that we have about all of the different requirements for state health departments. Sorry.
No worries. So, and that's really interesting to find out because we have so many people across Australia. We'll also be sharing some links that people can find with references to Tetra, so people have that info. So if we can just pedal back a little bit, someone that has endometriosis, is that a medication, a condition that's listed that can access medicinal cannabis if that person chooses to, or are they coming under the banner of chronic pain? What's the go?
Yeah, so under the approval process, it would be a chronic pain application, and 80% of what we deal with is chronic pain. So it would be detailed in their clinical justification, a little bit more about their condition, what the symptoms they are that they're experiencing. So it does get detailed, but as the TGA sees it, it comes in as chronic pain.
Georgia, in your experience, you are someone that has endometriosis, chronic pain, in the past it does rear its head sometimes, and you've also accessed medicinal cannabis. What was that process like for you?
To be honest, it was a lot easier than I thought it was going to be. Like I prepared so much stuff to take to my appointment. But I got the referral pretty much straight away from my GP. He witnessed me going to the hospital and prescribing all the opioids and everything, and he could see that I was having really bad side effects. So he wasn't too hesitant on giving me the referral because he could see I was quite desperate. So yeah, I got the referral, and then I think I got into a doctor within 2 weeks or something. But yeah, I had so much paperwork because I thought it was going to be so extremely hard. And then when I got in there, my doctor was like, wow, you're so prepared. You've got so much stuff with you. And I was like, well, I've heard it's really hard. And she was just kind of like, no, it's fine. And it was actually really straightforward. I think she uses the SAS program. Yeah. Because I get my products sent to the pharmacy, and every time I need a new product, I need the approval and stuff. So it was really interesting to hear about that, because I'm not too sure of how it works when people ask me. So it's good to know this stuff.
So the process is someone is considering medicinal cannabis to use as a part of their toolbox to manage their pain or condition. Then they go to their doctor and discuss, or their GP, and discuss, what they want to do. And that can be any GP or any specialist or prescriber or health professional that's a clinician outside of Tasmania. Tasmania is the only exception. Mm-hmm. And after they have that prescription, it's dispensed by the pharmacy. So you go there and pick up your normal scripts.
Exactly. So a lot of patients these days are seeing their doctors by telehealth. So a lot of times the doctors will ask, okay, where do you want your script sent? And the pharmacy piece is a little confusing still for some patients, because not all pharmacies will dispense medical cannabis. The process is very manual for them. It's an unregistered product for pharmacies, so it's not in their dispensing software. So they're literally filling out, PDF forms and sending them to suppliers to receive stock. Pharmacies cannot actually stock the product and keep it on hand, which is a bit frustrating for some patients, because they go through this big process. They go and see their doctor, and they take their script to the pharmacy sometimes, and they go, oh, we don't know what to do with it, or okay, we can get this in, but it's going to be another 3 or 4 days. So there's certainly things happening in the background that are automating some of those processes and allowing pharmacies to store on site, which is great. And Tetra, we work with certain pharmacies that set really fair pricing on the products, because unfortunately there is no regulation on the margin that can be set on medical cannabis products. So sometimes you go to the pharmacy and you think you're going to pay you know, say $200 for your bottle of cannabis, but then it's 250 or 300, and you go, whoa, what's happening? Why is it so expensive? So, you know, we work with trusted partners that allow us to provide really low cost options to our patients, and that's really top priority for us.
Okay, so let's get into that cost a bit, because this is a big one that people come in, and you've just mentioned it's not regulated. But so if someone is prescribed medicinal cannabis, they're already probably forking out loads of money to manage their condition, or, you know, and I see Georgia smiling, you know, acupuncture, physio, osteo specialist, it costs a lot of money. And if you do IVF, throw that on top of it as well. So for people that are wanting to consider medicinal cannabis, what investment are they looking to outlay?
Yeah, so if you're lucky enough that your doctor will prescribe for you, and you can do it in clinic, then usually they'll just bill Medicare, which is great. There may be a nominal fee to put on top of that to help with some of the admin costs in the back end, but usually it is a nominal fee. Now, the unfortunate part about some clinics, and look, there's lots of them out there, all kind of servicing different areas, different needs or specialties, but it's really important to do a little bit of research on which clinic is best for you. Some of them, unfortunately, do have hidden costs. They aren't really upfront about that. So you could actually walk away and spend $650 thinking it was only going to be maybe, you know, 100 or 200, and it really puts patients in a difficult position. So, you know, not all of them are bad. There's definitely some great ones out there. So just, you know, there's a couple of great resources we'll share for patients to be able to look for the best clinic for them. Now, as far, you know, for Tetra, it's $300 for the year. And so we provide an ongoing nurse support. That's two appointments with your doctor, 2 medications, all of the scripts. So if you are going to start asking some questions from clinics, you know, do you have any application fees? Do you have any re-scripting fees? How many medications does this include for me? So a lot of patients actually have to change medications or get something stronger. So, you know, ask those questions and get to know the clinic up front prior to making a commitment. And as far as the cost of medication, the good news is it's coming down. You know, a year ago, we were relying strictly on imported products. So the products are coming from Canada, you know, from Europe, and there's huge import fees, and then they're stored in like these scheduled facilities, and then they're distributed, you know, piece by piece to the pharmacies, because they can't bulk ship to pharmacies because they can't store them on site until, you know, Georgia comes in with her script and wants to get a bottle. So the good news is through the AP scheme now, you know, pharmacies can receive bulk orders, so the costs are coming down. More domestic suppliers are coming into the market, so there aren't all of these, you know, importing fees and logistics fees that get tagged on. On average, I think our patients would be paying, especially for chronic pain management, it's one of the higher end, would be paying between that $5 to $8 a day range. So when you break it down day by day, does it seem like a lot? No, but like you said, if you have all of these other treatments that you're going through, sometimes it can be a bit cost prohibitive. And it does, unfortunately, some of our patients get to that point. They say, well, it's either my X or my medical cannabis. But like I said, the good news is the costs continue to come down. And over the next 6 months, we'll see more and more domestic suppliers coming into the market.
Fantastic. Wendy, in your practice, you must see loads of people who, you know, can benefit, and also it may not be an option for them. Can you talk us about what you have seen in your GP practice?
Yes, it's such a big topic. It's hard to know where to start. So I know why most doctors don't prescribe medicinal cannabis, and that is because there's the barrier of it not having TGA approval or having to go through the SASB. So there's no controlled clinical trials telling conventional GPs how effective it is and what the dangers are. But I'll come back to that. So in my practice, of course, I see a lot of people suffering from chronic pain and endometriosis. Funnily enough, most of them don't ask me about medicinal cannabis or assume that we don't prescribe. And so I do have a little model of a medicinal cannabis spray on my desk, which could be a conversation starter. And some people look at that and ask me about it, but others just go, no, I don't want to do that. But it is just a conversation starter. Most of my patients have actually sought me out through accessing information on the internet and then finding out that I am a medicinal cannabis prescriber, and I'm also an authorised prescriber for some products. But the difficulty is for me as a GP, there's so many products on the market that I don't know who to approach to find out what all the products are. And so it's like an ad hoc arrangement of like a flyer coming in to tell me what they are, or a rep coming past to tell me what the products are. So some of my patients who are well researched come and educate me, and they tell me that they've done all the research and they would like to try this or that. Which sort of leads me to how I do decide how to prescribe, which is by asking them about what they've researched and their experience. Because we haven't gone into yet the combination between CBD and THC. And this is the $1 million question. When prescribing medicinal cannabis, like Deandra said, you have to have gone through all conventional other medical treatments before you're eligible. So if you come to me with your medical history and you have satisfied that criteria, then yes, I can get you a permit. But then where would you start? So some people are very reluctant to try any THC because of the implications on driving, which we can talk about later, or they've done their research and they're convinced that CBD as the anti-inflammatory component is going to be what helps their illness. So some of them have also come in and they're already using street cannabis. And yes, they're coy to say that, but actually for my prescribing, that's a bonus. Because now I know that they are accessing it and they are benefiting and they're not having any adverse effects. So that helps me. And then we can establish if they want to keep using cannabis as a herb, which you can do, which most people are surprised that they could access legal cannabis as a flower, or take it as an oil. So I don't know how much detail you want me to go into, but the oils are CBD, THC combinations, and you could start with a pure CBD oil, so you're not having to deal with any of the THC side effects. And some people just wish to start on that. And I would think if they were elderly, they had no experience, well, we're talking about endometriosis, so they're obviously not elderly, but if they don't have any experience with cannabis, that's a good starting point, right? There's also a school of thought where you start with a balanced oil, which is CBD to THC about 1:1, and see if that helps. The THC can potentiate the effects of the CBD. It is also excellent for pain management, but also other symptoms of endometriosis like the nausea. Maybe it will help with bowel or bladder symptoms. It's really an individual response. So you've got to start somewhere. So depending on whether you've got a lot of experience and you want a high THC, or you want to go to the other end of the scale, you just don't know how an individual patient is going to respond. And then in my experience, a third of people, like I alluded to before, have an excellent response. And that is what maintains my interest, because it's like, it's a miracle. I don't like to use that word because it is just another tool in your box. I don't want people to come in thinking it's Lorenzo's oil. But they do have just a really good response, which you can't deny. But another third of people don't have any response, which is disappointing. And then there's about a third in the middle that do get a good response, but not what they were expecting. And that's when you can talk to them about increasing the THC content, or maybe even if you are on a balanced oil, moving down to the CBD only. So I can't really pick which one is going to work for which patient. So it really is tailoring it to each patient's response. You might want to chip in and ask me a question, because I just don't want to go on monologue.
That was a really great monologue, Wendy. Don't worry. That was really Yeah, that was fascinating. And it's really good to hear that there's, I mean, everyone's different. Everyone is an individual.
Yes.
Just like some people get really great effects from a pelvic floor physio, while others don't. And it's the same for medicinal cannabis. Some people it works really lovely, others, you know, not so much. You touched on driving, which is a big one,
Yes.
especially for people who have to work or they might be a nurse. How does
Mm.
all of that happen? What, you know, what's the go there?
Yes, this is the million-dollar question. Okay. So on the product information, it does clearly say, or on our permits, that if you use a medicinal cannabis product, you cannot drive. But in reality, of course, we know that people do drive on cannabis, and it's really a moral decision by the person using if they are impaired or not. And of course, medicinal cannabis is about prescribing without getting the impairment from THC. So we're not aiming to get high, we're aiming to treat the symptoms. And so it would be unusual that we were prescribing to the point where a patient was impaired. However, if you were pulled over and did the roadside test, the tongue test, would it show up positive? If you were using oil regularly, or you just had using the vaporizer and used it at night, would it the next day show positive? We really don't know. I believe it's up to the officer if it did show up positive and you did have some validation that we were using it for medicinal purposes, that they would show this discretion. But we can't guarantee that. It's really up to each person to decide.
If someone was was using medicinal cannabis as a tool,
Yes.
would they carry a permit on them? Would they have that with them to show?
They could ask their prescriber to give them a letter, yes, validating that they were using it as a medicinal cannabis trial. And then it probably would be unlikely that the officer would pursue that, because honestly, just hearsay, how would that stand up in court? But officers aren't equipped to do that impairment test by the side of the road. Apparently only specific police officers can do that, and the average officer doesn't do it. So it's definitely really a sticky area.
Yeah. It's really interesting that you touched on some people are using medicinal cannabis from the black market, we could call it, and that so we know people are accessing it. We you know we're not blind to that. And why do you think people are accessing it on the black market?
Look, frankly, they're going to be desperate, and they've tried every other means of controlling their symptoms. I don't know how common it is out there, but a lot of people in their lifestyle, it's common. You know, we've all heard that it can help with endometriosis and pain. So if they do have access and they're in those circles, they will be open to trying it. And then when they do see the benefits, of course, they're going to keep using. But I believe someone else is going to tell us about all the problems with accessing illegal cannabis. And that's why I'm very happy to prescribe, because at least with harm minimization, people can have access to something which is got no additives in it, is organically grown, is going to be delivered to them in a way where they know exactly what they're using. And the thing with medicinal cannabis is that you're liaising with somebody about what your dose will be. And yeah, that is an enormous benefit.
Absolutely. I'm really pleased to hear that you touched on that. It's in a controlled environment with a care team around you.
Yes.
So they know how that's interacting with other things that are going on for you.
Yeah, exactly. Because a lot of people are on lots of different medications. They do need to be advised about that. Yeah, I'm very happy to prescribe and keep people safe.
Absolutely. Georgia, have you ever worried about driving with your prescription? Is that something that's all working?
I do get worried about it, but my prescription, I have separate. So I've got a CBD bottle and then I've got a THC bottle, and I mostly use the CBD. That's the one I use daily, and then the THC, I only use that if my pain's at a higher level. So if I'm in a bad flare, that's when I'll use that. So I don't really use it that much, and if I am going to use it, I use it where I don't have to drive for the next 3 to 4 days. And where I live, it's quite central, so I'm quite lucky. I can just get on my bike and bike places and whatnot. But it is worrying, it is. But unfortunately, from what I know, I don't know how accurate this is, that the roadside testing isn't like accurate at all. Like someone has a THC, I don't know, a week and a half ago, and it can come up. So it's, unfortunately, it's something that I have to risk, because if I don't take it, then I can't live. Like I can't keep going. So I mean, I'm mindful of it, and I do try my best. Like, I definitely wouldn't take it and then go and drive down to the shops. That's something I wouldn't do. But
no, and I guess if we flip back to the black market, which we're going to get into in just a moment, there are some people that are engaging in that for managing their chronic pain, and if we can bring that into a controlled sense of prescribed medicinal cannabis, everyone will be safer. We bring that in as a tool. So let's get into that. So we have Tegan here, High on Hemp founder, to talk about the black market. Is it an issue in Australia? What's the go?
Look, most definitely. In saying that, Australians have been using cannabis for a very, very long time, and it is, the number one most, used illicit drug here in Australia. Just seeing some of the data come out over the last couple of months is still showing that people are still, buying cannabis from friends, from local producers. But what we're seeing now, especially in terms of the CBD market, is that there's been such a boom over the last, 12 to 15 months really, and we're seeing a lot of uninformed sellers actually selling CBD products, and there's a lot of risks that comes with that. So, touching on what Deandra mentioned earlier is, about how lots of people are importing product. We're seeing the exact same thing here in the black market. So what that means is individuals are buying CBD from overseas and relying heavily on suppliers' information that they're giving them, and then using that to sell out to strangers. So they've never walked through their crops. They've never seen their infrastructure. They don't know how this is being processed, and really they don't know how it's being labeled either. So they're taking on a risk, and then they're selling that product onto consumers, which is really scary, and essentially the domino effect of that is, the marketing claims that come with that, right? That, a lot of people are buying into the hype of CBD at the moment, that, you're going to take CBD and it's going to, change your life, or it's going to make your life more manageable. And for some people, it does, and it does work. However, at the same time, cannabis isn't for everybody, right? And not all cannabis is created equally as well. So when you're going and buying through the legal market, you're getting a regulated product, in return, which is what you need. And especially when you are mixing it with other medications, as Dr. Wendy mentioned as well, it's really important for you to have a relationship with your doctor, and be able to, speak to them and be with them through that process as well. So earlier this year, we were lucky enough to partner with a company called CBD Reviews Australia. So they're a Facebook page which is, dedicated to helping consumers, understand quality of products here in Australia. And we did an independent test with them on 62 black market products, which are currently being sold. And, the results that came out of that were incredible. So you had a 1 in 4 chance of buying a product that isn't essentially what you think it is. So it was rather labeled incorrectly, or the cannabinoid content wasn't, what they said it was. And in saying that, you had a 1 in 9 chance of being sold a fake product that had 0 cannabinoid content with it. So, and I know that might sound, it's only 1 in 9 chance, but when you're seeing the mass amounts of companies that are coming into the market, last month, as an example, I noted 50 new companies on Instagram alone that are now selling CBD oil and saying that it's legal, saying that, making claims about it, healing you and, healing you maybe if it's for, cancer or anxiety or depression or chronic pain. And that's just, for me, it's quite predatory, because there are people who are trying to, invest into their health, and not knowing what they're getting back in return is a really scary thought.
You've mentioned it's only 1 in 9, but for that one person, it's massive for them. It's not, we know how many people 1 in 10 have endo, and for that one person, it's massive. So, and if someone has gone down the path of thinking about trying medicinal cannabis, and perhaps, got one of those products that isn't what it says it is, that's really dangerous for them, and really taints the whole view.
100%. And one thing as well is, pricing is obviously a big topic, right? And there's a negative narrative at play at the market at the moment that, when you go legal, that it is more expensive. And undoubtedly, the process is a little bit more expensive. But the key aspect to buying CBD, as an example, is, the concentration and the amount of active ingredients within the bottle. But, one of the main factors is actually understanding the milligrams, the active content in the concentrate. So if you're looking at black market sellers, sometimes what we're actually finding is the milligram pricing is actually higher in the black market than the legal market. So in one of the article that we put together, that we launched the information about the testing that we did with CBD Reviews Australia, one of the examples was a 2,000 milligram bottle. And, when you break that down, I think it was, don't quote me on this, but I think it's 66.6 milligrams of active content within the bottle. But when you looked at the legal route, they had a bottle which was 240 milligrams, but what you were actually getting is 240 milligrams of active cannabinoids in there. So you're getting actually 4 times the amount that you are in comparison to the black market. So when you start actually breaking that down and seeing the cost per milligram, it's actually in some cases cheaper in the legal route, which I think a lot of people don't really have an understanding of as well.
Yeah, that's fascinating. And it's also, I'm coming back to the legal, just people know what's in there. We know how that will interact with, well, the doctors will know how that will interact with other medications that you might be on. But that's a really, a really big market. So if someone's looking for medicinal cannabis, how would you tell between something that's on the black market as opposed to what would you call it, a authorized product?
Yeah, well, cannabis can only be prescribed by a doctor. So anything that you're seeing online which is being sold directly to consumers is illegal. And that doesn't matter if it's derived from hemp, because that's also another issue in the market as well, is that because industrial hemp is legal, when they call it hemp oil as an example, that they sell it as being legal when it's definitely not. Anything that has, you know, CBD or, you know, THC, you know, of a high content within it, it has to be prescribed through a doctor. So it's, you know, it's logical when you look at it, but, you know, it's because there are black market sellers out there who are essentially selling lies, and they're actually cashing in on telling people how difficult it is to obtain legal cannabis. Yeah, they're telling people,
so right.
Yeah, they're telling people you'll never get it. You know, they're buying into, you know, the media of, you know, it took me 3 months to be prescribed, you know, medical cannabis. And, you know, it's that is the issue. When at the end of the day, supporting the legal route, you're actually, when you support the legal system, you're putting money back into the industry, which is infrastructure, which is desperately needed in the industry, but you're also putting money back into the hands of people who are investing into clinical trials and much needed data. At the end of the day, when you're buying a black market product, you're essentially supporting someone's lifestyle. It's as simple as that. You're funding for them to live, because they're not putting that money into what we actually need. And, you know, talking about what Deandra mentioned as well, is that when you do invest your money back into the, you know, back into the legal route, you're actually creating I guess almost like a domino effect, especially with GPs as well, because you're being able to actually educate the educators, which is what needs to happen at the moment, which is GPs who are, you know, still sometimes on the sideline with what, you know, so on the sideline about actually prescribing it. So when you show a doctor, as an example, how cannabis has actually helped you, it helps them to actually, you know, push that onto somebody else that it may be, you know, worthwhile their time, or maybe an option worth exploring for them. So yeah, it's really important for people to actually understand, you know, the importance of going legal. And over time, what will naturally happen is more people who are supporting the legal system, the cost of product will essentially go down as the demand goes up. And that's just business 101.
If I can jump in, Tegan's so right, and it's so frustrating, and you can hear the passion in her voice and frustration as well, and we all share it, because we're so regulated as legal companies. We can't advertise product to consumers. We get cease and desist letters from the TGA, and yet there are all of these illicit companies just flagrantly, you know, promoting their products with fictitious claims. And it's very hard, because we put a lot of time, energy, love into building this industry and doing it the right way. And to further Tegan's point on, you know, investing back into the legal channels, you know, these products are unregistered products, and for companies and suppliers to actually get them to be registered products take millions and millions and millions of dollars in investment. But that, in the end, you know, in 3 years, in 4 years, we'll actually have, you know, PBS funded medications that will only be $12.50 when you go to the pharmacy. And I know it seems very unfair for those that are having to kind of foot that bill right now, but you know, like Tegan said, it's sometimes more expensive to go through the black market. And, you know, having been in Canada, which we have a legal growing opportunity for registered patients. So I grew cannabis for a long time, and I've seen, and I'm sure Tegan has too, she walks through, you know, legal crops all the time. And, you know, without that experience, without knowing how your medicine is grown, a lot of bad things can happen, you know, powdery mildews, carcinogenics, plant growth hormone, like there's just so much junk. And people say, well, it's just cannabis, you know, just let, you know, and it's a very socially driven kind of movement, because it has been an underground movement for so long that there's kind of a resistance against the corporate way and the legal way, but there is good there, you know, and it's not saying that it's all good. There's definitely some cowboys in the space, in the legal space, but you know, that will sort itself out in time. But yeah, it's so critically important. We're at such a pivotal place right now in Australia, where we're about to see huge growth, and so it's coming, and good things are happening.
You touched on something really interesting there around patients. There is a stigma around medicine, around illicit cannabis, you know, using it and bringing it to a legal sense can be really probably quite daunting for someone that has relied on it for so long, or they want to talk about it with their GP, but there is this stigma around it because maybe they have been accessing it illicitly and they want to come over and, you know, join the legal path. How can anyone give any suggestions as how to initiate that discussion with your doctor? That could be a really, really big thing to overcome. Does anyone have any suggestions around how to even broach that topic with them?
Doctor's point of view,
yeah,
I would say that is an awkward conversation because most doctors are not aware of the difference between illegal cannabis use and the benefits of medicinal cannabis. So it's like an admission of using an illegal product. So you would have to sound out your doctor first to see if they were up to speed with what medicinal cannabis was, because that would just be a put off. And a lot of doctors are afraid that they're going to attract users and abusers of cannabis. So when they start opening up their doors to, I'm a medicinal cannabis prescriber, they just imagine a queue of people who are trying to access weed at their door. Just like if you start prescribing inappropriately benzodiazepines or opiates, you're going to attract a drug-seeking community. So I think that's one of the biggest barriers for GPs being open-minded to prescribing. And it's only when you've been working amongst other doctors who are prescribers that and starting off myself, that you realize that doesn't happen. So that is a really awkward conversation to start up if you've been accessing cannabis already.
Yeah.
That's why when you go online like to Tetra, you know, they're experienced with people who have already accessed themselves. It's an easier conversation if you're just wishing to seek access to CBD oil, because they'd be more open-minded about that. Yeah. And it's even marketed to us doctors as medicinal cannabis without the hallucinogenic effects. Like, that's wrong in itself, okay? But that's how it's promoted to get doctors interested in prescribing. So there's a whole sorts of myths that you have to work through. I was also going to mention something else about the illegal cannabis, in that, well, I did hear that the street cannabis is grown from the indica strain because that's the easiest plant to grow. And so in the medicinal cannabis field, you've got access to a whole different variety of strains of cannabis, which are bred for their medicinal properties. So in opposition to just the street indica, you can use a sativa plant or oil. And then there's all sorts of other medicinal properties in cannabis, like the terpenes, and the strains that are used for medicinal cannabis have been grown to increase the terpenes for different varieties. So it's a bit more complicated than just street cannabis.
Okay, so for those who probably have just had their mind blown right now, it is not just one type of blanket cannabis, marijuana, you know, it's not that there's different strains, and I understand those different strains would act on really particular groups of things.
Yes, exactly.
Yeah.
So, thousands.
Yes, so when you go down the medicinal legal access route, you've got access to people who are familiar with all the different medicinal properties of the different strains. So then you're talking different oils, what different companies can offer you. Some of them have like really refined what's in their oil. It may not be the CBD or the THC which is giving you the medicinal effect. It might be some of the other components in the plant called terpenes, which are benefiting you. Just to throw that can of worms open.
Yeah, well, it's another reason to work with someone who can prescribe that to you, so they have a full understanding of your body and what's going on for you with an educated angle to work this out. And is this why it can take a little while to adjust or work out your dose and your prescription? Is that why that's the case?
Yes. So you might have someone who's getting an amazing effect on one particular CBD oil or combo oil, and then they swap to something else because the other one's not available, and they don't get any effect. And then only through knowing the composition of the oil that they were on the first time can you get them back to that place. So yeah, it still is trial and error, but it requires more of a scientific approach than just using cannabis.
Sorry. We do find it takes about 4 weeks. A lot of our patients get discouraged because they go, they've been waiting so long. They have this build up and expectation, and they take their first, 0.1 of a mil because we have this approach of start low, go slow, increase slowly so your body can adjust to it. And they go, oh, it didn't do anything, and they get so discouraged. But you have to kind of trust in the process and trust through that titration period, which usually takes a month to really get that optimal dose that works best for you. And sometimes patients that are using THC products do have to, their bodies need to get accustomed to that drug, just like any new medication. So we do work with patients very, very closely, and Wendy works with them to titrate them to a place. And then if they're dropping off of other drugs, a retitration might have to happen. So if they're decreasing others, we might have to increase cannabis just a little to kind of even that out. So there definitely is a very close, collaborative process between the patient and their doctor for that first month to 2 months. And then usually once you get there and you get to your optimal dose, it kind of, you get a lot more comfortable with your day-to-day dosing.
Georgia, when you went to your GP and you said that you had, reams of paper of information ready and prepared, what type of information did you feel as someone who was seeking, medicinal cannabis through the legal path? What type of information did you feel you needed to present?
I literally took everything.
What does everything mean?
So I had blood tests, I had surgery photos, I had communication between my GP, my specialist, I had hospital discharge reports, ultrasounds, literally everything. Because I was like, as we spoke about before, in my head it was so hard to be approved. So if I'm paying for this appointment, I've got to make sure I get it. So literally, I took everything with me. Everything.
We've become really used to advocating for what we want as people with Endo. I don't know, don't we? You're ready. You've got
over the years. It's been a work in progress, but I think I'm there now.
But it sounds like it despite what we might mentally build it up to be, it seems like a really approachable process if we work with clinicians and GPs who understand the process. And it sounds like it's becoming really the more we can support the legal path, I think the easier it will come. And certainly this discussion has facilitated how to get there. Georgia, as someone with Endo, what do you think about it? How has it helped you? How does it work as a part of your toolbox? And do you have any suggestions or messages for people out there with Endo who might be considering using it?
Yeah. Well, like you guys were just saying before, when I first got my prescriptions, I guess I should start with what I was prescribed. So when my first prescriptions was a CBD bottle and then the THC bottle, and the THC was to add in when the pain was quite bad. So I take the CBD every day, which is amazing. And I add in the THC. And then, but when I first started, I reacted really bad to the THC. I was in bed and couldn't basically get up. I was just so out of it. And this is where I think the legal route is so good, because I went back to my doctor and I communicated that with her, and I said, you know, I was feeling really anxious, like the THC made me feel like really like out of like control kind of thing. And then she's like, all right, well, we need to increase your CBD dosage, like spoke to me all about like how much I was taking, and now I'm at a point where it's when I have the THC, I like don't really even notice it mentally, if that makes, like, I know it's there, like I know it's taking away the pain, but I'm still able to function, like, whereas when I first started taking it, I was like, I don't think I'm going to be able to like do my uni work with this, like, but now I'm at a point where when I do take it, it's just kind of like I figured out the right way to have it. And I'm like, when I first got it, like within probably 2 weeks, I wasn't sure if I was going to continue taking the THC oil. But then, yeah, speaking with her, she reassured me and adjusted dosages. And to be honest, I didn't realize there was so much to it. I thought it was just kind of like, this is what you do and that's it. But since taking it, it's so complex. And we ended up adding in a flower prescription as well, because there was times when the THC oil was taking between an hour to like become effective. And if I was in really bad pain, then I'd find that was when I'd be reaching for like the pharmaceuticals as well. So then that made the process of waiting for the oil like bearable. So it's definitely like, and I still consider that I'm still learning and still probably not at where I could be, but yeah, I think having a really good doctor is what you need, especially with endo as well, because it is so complex.
Absolutely. And communicate, you know, what I got out of that is you just kept communicating with your doctor who was working, and you worked together to get to a place, and you know what works for you now. And we know with endo you'll get to a place where you are managing it, and then there'll be a crossroads, and you need to, you know, level up and add some other things to your toolbox or reconsider what's in there.
That's exactly right. And there's another symptom coming in this month and another one the next month. I think with endo and cannabis, it's definitely going to be like an ongoing managing, figuring it out, learning kind of thing.
Just like anything, isn't it? Just like any other tool that we have in there. Well, thank you so much, everyone. Does anyone have any other comments or feel as though they would like to share any final thoughts?
Just finally, I'd like to add how safe medicinal cannabis is. Another good reason for me being open to prescribing. So you just cannot overdose on it, which is just fabulous to know, unlike many other medications. So that is a big bonus.
Absolutely. It absolutely is. Is there any other comments that anyone would like to add?
Just a clarification on an earlier point about the driving, just to be clear. So you can actually legally drive on CBD medications. So it's only the THC medication that can be detected in the roadside test. So that's when Wendy said, you know, it's really great to start off with CBD because it doesn't cause the impairment, and there's no risk of it actually showing up in a roadside test. So for those that are a little nervous about starting, it's a really good place to start. And the only other point on that is, if you are working and are using THC medications, we do advise patients to have a chat just like they would with their doctor and say, hey, you know, what do you think about medical cannabis, and start that conversation. We do suggest that they also have an open conversation at work. Look into the workplace drug policy and see where there may be some leniency or openness to you using medical cannabis if there are drug tests at your workplace. And we've had a lot of companies with people with chronic pain that are so open to their employees using it, you know, at nighttime to help them get better sleep and better quality of life, and then using CBD during the day. It's been really wonderful to see so many, you know, different groups really coming on board and supporting people with chronic illness.
Yeah, and their productivity would probably increase if they're getting more sleep.
Definitely. It's the first thing that we see, I'm sure Wendy would echo, is, and I'm sure Georgia felt, is, you know, when you finally get that, you know, 5-6 hours of sleep and you can eat and function in your day to day without having that constant thing, you know, kind of in the background, your quality of life just goes up. So
Definitely. And I think as well with the nausea for endo and adeno and stuff, it's like the best thing for nausea, or even just like stomach cramps, like everything. But like for me, the sleep and the nausea was like a big difference.
Just to
Absolutely.
from what Deandra said as well, is, you know, there is still, you know, a major stigma attached to cannabis, and the more we can openly talk about it and just communicate our experiences, you know, our opinions on it with, you know, our families, you know, at work, and, you know, just create that domino effect and start, you know, getting out there and talking about it, it will, you know, maybe perhaps get somebody over the line with, you know, looking at it as an option. However, in saying that, you know, just know that, you know, cannabis isn't an overnight destination. It's a journey. You know, it's not a one-trick pony, and anyone who tells you that it is lying to you or just trying to get your money. So just, it's a journey, and yeah, and do it safely and wisely.
Most things that are an overnight aren't sustainable. I think we all know that with
Exactly.
you know the decades of diets and all of these wonderful, amazing things on Instagram that cure everything.
Exactly.
I think people with endo, we can be really desperate because sometimes we're in such a spiral because we don't know, you know, we're in so much pain and we're tired and we're exhausted. And so it's easy to fall into those boxes of vulnerability. But what we've talked about today is, it is to access it. There is a process, but it is easy. You can start those conversations with the right people, and we'll be sharing who they are and how to find them in the coming weeks. So I'd just like to thank you all for providing your expertise and thoughts and experiences with this, so people can understand it is an option for the toolbox. It is an option, and we've just spoke about processes and access paths to add this. So thank you all very much, and we will be hopefully bringing some more content on this in the months to come.